The University of South Alabama program is a combined pulmonary and critical care. I wanted to see patients who are more acutely ill. I get driven by acuity of illness. That's what I realized. Pulmonary and critical care give me this option of taking care of patients and doing procedures. So it's a well-rounded specialty.
It's a 3-year program, and at the end of that time, people are eligible to sit for both the pulmonary and the critical care board, so they can get double boarded. We have 6 fellows, so we have 2 fellows each year. The first year is mostly doing pulmonary consults, doing ICU medicine, and also doing some outpatient clinics. The second year, they start to do some of these outside rotations. They go to Birmingham, they go to the community hospitals. And then during the third year, they spend most of the time doing research, although 2 months they're here in the hospital doing intensive care medicine, taking care of patients and teaching residents and medical students.
I felt the University of South Alabama has the feel of a tight-knit community hospital where everybody knows everybody and a lot of the communications are informal. But also it has the drive and the energy of a big academic center. We have basic science research, clinical research, so it has all the elements of an academic center but the feel of a community hospital.
The size is an advantage mainly because it allows more access to the faculty, better mentorship. They interact not only with the medicine service but also with the burn unit and the surgical trauma unit.
You know, having a trauma center, of course, is very important because as a pulmonary and critical care doctor, I am going to have exposure to that.
The fact that it's a level 1 trauma center and we have helicopters flying in and out all the time, and it's a burn center. Mostly those are managed by the surgeons, but a lot of it's medical care and how do you manage burns patients and how do you manage trauma. And our fellows see that and they need to see it, so they get a broad depth of ICU medicine. As a fellow, you're not only responsible for your own learning, but for the learning of other people, residents and medical students. Everyone's got something to contribute. And I think our fellows are trained better because they're with medical students who push them, who ask questions, and who actually can also contribute to their learning.
We are always trying to do things in a better way. So that sense of progress that's ongoing is very helpful for trainees.
Their job as physicians is not just to learn what's out in the world, but also to contribute. And that's, I think, where the 12 months of research come in. Medicine's not stagnant. I think our goal is to teach them, how to think, not necessarily what to think, but how to do it and how to integrate it so that they can contribute to solutions in the future.
You're going to get a well-rounded, high-quality education in a casual environment. We have friendly staff, and you will get a diverse education and exposure to patients and procedures.